Hello, and welcome to the first official episode of our podcast here at the Center for Digital Health Research, or CDHR. I am your host, Pierre Ducharme Gauthier. Every episode, we'll discuss novel, transformative research in the realm of digital health, chat with an expert in a related field, or introduce you to technologies to keep an eye on. We are incredibly excited to have you here listening and learning with us throughout our episodes. Now, you might be asking yourself, what is the Center for Digital Health Research? Now, before we answer this question, let me introduce you to the incredible inaugural director of the CDHR, Dr. Nazanin Alavi. Hi, Dr. Alavi, how are you today?
Hi, Pierre. Thank you. It's great to see you.
Great to see you as well. Now, first, do you mind sharing a little bit of your background with us and what you do?
I'm a psychiatrist and associate professor at Queen's University. I've been working in digital mental health for over 15 years now. Clinically, I work across emergency psychiatry and outpatient settings, and also in inpatient psychiatry sometimes as well. So, firsthand, I see the challenges of patients. Who face timely access. Alongside that, I lead a research focus on how we can use technology, particularly AI and online psychotherapy, to improve access, personalized treatment, and make mental health more efficient and scalable. I also lead the Center for Digital Health Research, where we bring together clinicians, researchers, and technology experts to rethink how care can be delivered.
Wonderful. Now, what interested you in medicine and psychiatry in the first place?
That's a good question. Well, medicine, it combines science with human connection. Um, When it comes to psychiatry, in particular, it was very different for me when years ago I did my first rotation in psychiatry, and it stood out to me because
Mhm.
it is so different with the rest of the medicine, at least for me, it allows you to understand people's experience in a very deep and meaningful way. Um, what I found early in my career, though, it was that despite how impactful psychiatric care can be, access to it is often limited. For me, it was when I started this career in research was myself when I immigrated to Canada,
Mhm.
and I realized like many people, uh, who immigrate, for example, and they want to get mental health care, they would like to have access to a healthcare professional, to a therapist who knows their native language and their culture, and that might not really be available in where they live. So I thought, what if I could make something, develop something that's it is digital. So if the therapist is not in their same city, the same province of, or even not same country, they could have access to it. And that's when, it's now around 20 years ago that I started online psychotherapy and digital mental health. And that gap between need and access really shaped the direction of my work.
Mhm. No, that's amazing. So, in terms of kind of your why digital health research, kind of really based in terms of making sure it's accessible to everyone is really like the focus as well.
Yeah, so as I said, what excited me about digital health was the like me realizing that we don't have to accept those limitations,
Mhm.
um, as like they were fixed. So technology gives us, or a way to rethink the system delivery. So we can think outside of the box. That's how, like I thought, for example, instead of patients like really waiting months to be seen, what I have been doing, and it is part of the work with like the team that I have, we can triage them, right?
Mhm.
Touch them to the right level of the care and even start treatment. through the online platforms, it's not just about efficiency, it's about equity, right? Which is very important. Access, delivering the right care at the right time. This is what is the most important thing.
Mhm. Wonderful. And then how does your work specifically link to digital health research? And kind of what research are you currently conducting within the field?
Yeah. So my work sits right at the intersection of clinical care and technology. We have developed AI-assisted triage systems with the team that significantly reduce wait times and online psychotherapy programs that can be delivered um, at scale. And more recently, also AI tools that support clinical decision making. So what is important to me is that everything is built grounded in real clinical need, right?
Okay.
And we evaluate it. So what you want to be doing is not just make something and then don't like it. You want it to be evidence-based, right? So you want then to implement it to make sure that it truly improves the outcome for the patient. So that is our goal.
Absolutely. Wonderful. Now, kind of going back to our original question of what is the Center for Digital Health Research? Kind of what do we do here? What are our goals? And what is our philosophy or the CDHR's philosophy as a whole?
Yes. So our Center for Digital Health Research, um, is um, so my work is in mental health, right? But the center is digital health research for all different fields and is really about bringing people together. Our goal is to bridge the gap between technology and the healthcare, right? And we want to create solutions that are clinically meaningful, right? So um, the connection of these two, our philosophy is simple, right? Start with the patient and the clinical needs, and then we put heads together, right? We're different teams, we co-design the solutions, and then we have to evaluate it. We want everything to be evidence-based, right? And then we implemented it. We are not just developing ideas, right? And we want to focus on the real world impact, and that is the end goal.
Yeah, that's wonderful. Awesome. Now, why should the public listen to this podcast? And kind of like, what do we bring to the table? Maybe something different, or yeah,
I hope that we bring something different to the table, right?
of course.
So, the podcast, I'm hoping that it is about making digital health accessible and
Mhm.
understandable, right?
Yes.
We are talking about cutting edge research here, but,
Mhm.
in a way that we could connect everyday care, right? What it means for patients, for the clinicians, for the healthcare system, something that it means something to everyone, right? Whether you are a clinician, whether you are a researcher, or you are some only like, or just somebody that is interested in healthcare, we're hoping that this podcast can give you some insights how you can be part of the change.
That's wonderful. Now, kind of in a general sense, what are some of the benefits of digital health and pursuing research within this field?
That's a big questions many people ask, and like there is a lot of unknown here, right? So in my opinion, the benefits are significant, right? So overall, right, there is improved access, there are reduced wait times, there are more personalized care, right? The ability to scale. Of
Mhm.
course, there are challenges in any kind of change. There is challenge, right? The data privacy, there's a big question about that.
Mhm.
Like ensuring equity in access, making sure these tools are used safely and ethically, right?
Absolutely.
But I believe that the advantage overweigh the risks. And especially when we approach, digital health thoughtfully, which is very important. We with strong governance, right? We should have that. We should have clinical oversight
Mhm.
and commitment, right, to evidence-based practice.
Absolutely.
I think that the benefits are more significant and it outweigh the risks.
Mhm. That's wonderful. And then, in let's say 10 years, where do you hope Canada and the rest of the world will be regarding digital health research? Are there certain areas of research you hope will have begun focusing on by then, or kind of avenues to start on?
Well, 10 years is a long time. So I hope that, digital health is no more like an add-on. I hope that is integrated in like,
Mhm.
part of as a standard. I like to use like, to see AI as like, as not replacing, but like as supporting us in
Mhm.
clinical decision making. And we see a seamless transition between levels of care, truly personalized treatment pathways is one of the goals that we have. And, helping in, for example, significant wait times, which is one of the things that is a challenge at this time in clinical work. I hope we be more focused on areas like, prevention.
Mhm.
Uh, for example, also in the field of mental health, early intervention using data to identify a risk earlier.
Mhm. No, that's great. And I really love the point in terms of AI um, and really being more of a supportive aspect of kind of the healthcare system and instead of thinking of about kind of it replacing it. Because I know that's a fear that has kind of come up regarding a lot of different jobs and even within healthcare. But I think it's really important to think about the fact that it is really there to support and kind of help us along. Um, and it can be of benefit more than just kind of a nuance or a nuisance, sorry.
Yeah, you're very right. Like one of the like things that some people are afraid of is like would AI like replace us? And what I would like to say, like I think we see AI as something that could help us. That we see where like the best fit is for us to be, and the AI can help us in the places that we need, as like Uh, integrating and so that like we could use our like strengths in the places that is a better fit rather than AI replacing human. And that's the important thing that we should focus on.
Yeah, absolutely. All right. Now, what is something you'd like to say potentially to inspire current or future researchers, kind of at the intersection of technology and healthcare?
So I would say this is actually one of the most exciting times for us working at the intersection of the healthcare and technology. But also it's important to like, stay grounded, just not build something, innovative and then it is to build something meaningful, right?
Mhm.
We have to work closely with patients, like, with clinicians, with communities. We should understand the needs. We should be thoughtful. We should be ethical. We should understand the impact, but also we shouldn't be afraid to challenge how things have always been done. And we shouldn't be afraid of what the future is. There is a real opportunity here to transform care, and that is incredibly powerful. So I truly, Pierre, I truly believe that if we do this right, digital health would just it won't just improve the system, uh it will change how people experience care, and this is it's an important thing. Yeah.
No, absolutely. I think it's great as well that within the center, we're not only looking at, healthcare researchers or clinician scientists. We're really also thinking about partnerships with different kind of sectors, different fields, and utilizing kind of people who have great knowledge on AI or on um, large language models, things like that. I think it's kind of great to see that. we're really there's an intersection between a lot of different fields instead of really just focusing on medicine. I think that's really important as well.
I see that I think this is a great time for us, and I think there a lot that we can do.
Mhm. Absolutely. Perfect. That's the end of the questions I have for you today. Any last thoughts or words you'd want to speak on?
So, just want to say we are very excited that we are doing this work and collaborating with many other different teams across Canada and in North America, and we are hoping to be able together to make a positive change.
Wonderful. Thank you very much for joining us today, both to you, Dr. Alavi, and to our listeners. This was just the first of many different episodes, and we hope to have you join us again as we embark on a little journey across lots of different topics in the world of digital health research. Thank you
Thank
very
you.
much.
Thank you, Pierre. Thank you, and it was a pleasure.
Thank you. It was a pleasure.